Good. Great. Okay. Well, I'll kind of go ahead and get started just with introduction and everything. So this talk is, it's not meant to be an end all or super detailed as far as, low back pain or the spine or the back in general, but just a little bit of an overview. And I wanted to, my presentation is not very long. I wanted to make sure we had lots of time for question and answer. So really just a quick overview of back pain, maybe dispelling a few myths, and looking at different possible root causes if you are experiencing back pain. So let's go ahead and get started. Thanks so much for joining in. So your low back hurts. Well, who gets low back pain? You maybe, but it's really everyone. That's the short and dirty answer to that question. Pretty much everyone has low back pain at some point in their life. 80% of adults will be seen for low back pain at some point in their life, which means I'm thinking everyone has it, and there's a few people that just never do anything about it. They can just tolerate it as part of their life. It's the number 2 reason out of anything people visit the doctor. And, symptoms can vary. It can be just kind of this muscle achy thing, shooting, stabbing, it could be radiating down the legs. It can result in limited range of motion, inability to stand straight, things like that. But, if you have low back pain, you are not alone. I think that's the biggest takeaway. So really, what are some of the things that contribute to that low back pain? So these are a few of them. It's not saying if you fall into one of these categories, you will have it. But combined together, these are things that maybe some of them you can adjust in your life to decrease your chance of having low back pain. Obviously, we can't affect our age. We are what we are. And so if we're over 30, which I think we all are, that's just going to increase our chances. Just statistics there, nothing big. Physical inactivity, that's something we can do something about. Obesity, we can change that. Arthritis, we can not necessarily prevent it, but we can prevent with activity kind of the painful results of it. Osteoporosis, we can affect that. Pregnancy, short term, but that can definitely make a difference. And as you can see, smoking, different psychosocial factors, occupational factors. What are you doing during your work or your life? And then the last one, poor posture. I think that's a big one. Always told to sit up straight, but there's more to it than just that. But anyway, this is sort of a general breakdown of what contributes to low back pain. I think it's also important to know, have a general understanding, a very basic understanding of what is your back or what's it made out of. At the very center, at the core of the structure, is your spine. And at the center of your spine, which is the bony part, is your spinal cord, right? Which is the nerve. And sometimes we confuse those two things. So the spine itself, all these vertebral bodies and all the different parts that come off of that are there to surround and protect your spinal cord, which obviously is very, very important. It carries all the nerves from your head all the way through your body. And so when you're looking at all these segments, right, they're made to move on each other, forward, backward, rotate side to side, bend side to side, right? And if you notice, there's a lot of them, right? There's five in the lumbar spine, plus 5 in the sacrum. You got 12 in the thoracic spine and 7 in the cervical. So altogether, when you move, when you bend, when you rotate, they're all working together to create, let's say 100% motion, whatever that is. So what percent is coming from each segment? Just a small percentage. And if one is blocked, you can imagine that maybe one or another is going to try to make up for that, right? And maybe that can lead to some problems. In between the bony parts, you have your intervertebral discs, right? Those are made out of connective tissue and they have a fluid inside of them. You've ever heard of a bulging disc? That's what we're talking about, the piece between the bony vertebral bodies. And with trauma or sometimes with repetitive stress, we can get a situation, if you imagine putting like a sack of fluid in between two structures and pressing out, you could see how changing the pressure gradient could potentially lead to kind of that bulging out. And if you looked over to the right side of the screen, we have all these nerve branches coming out from the spinal cord, and those are all going out to the different structures in your body, your arms, your legs, your hands, your feet. And if that disc protrudes too much, it can put pressure on and disturb the conduction of those nerves. So that's what's going on with kind of that bulging, herniated disc you might have seen. Another way that those nerves can get compressed is if you look at the, it's not a great picture, but at the side view there, there's like a little pocket between the higher and lower vertebra that the nerves come out of. And if that space, you can imagine, it's like a narrow kind of hole that we'll call the foramen. If that gets condensed and compressed, that can also press on the nerve. So different ways to kind of affect the nerves, and that's what might give you that radiating pain that goes either down the arm or down the leg. So that's basically the core, the center of your back. On top of that, we obviously have lots of tendons, ligaments, muscles, and they are a lot of them, right? There's really, really deep ones, and then there's different layers as they come up, and then the ones that you can see on your back are the most superficial. And those are all broken down into two main categories. I won't go into the specific muscles, but there are stabilizer muscles and there are movement muscles, right? So there's some that are made to keep you stable, and there's some that are made to move. And if somehow one's not working and the others are trying to take over for that other person's job or other muscle's job, that can lead to problems as well. Looking at it in a more global sense, we often think of the body as having these different fascial or connective tissue lines. There's some really cool research that has been done with that. And so it's, instead of looking at the muscles as individual actors from an attachment point to an attachment point, we're looking at the body as a whole. And if you see kind of this second to the right guy here, that's the entire back or posterior chain going all the way up from the skull down to the heels. And the theory with this is anything along that line can affect anything else along that line. So you can see how things crisscross, go in diagonals, run up and down. And so, low back pain or low back issues can cause, we went over this in class the other day, can cause hip issues or knee issues. And ankle issues can cause low back issues, right? Something in your ankle could even cause something happening in your neck, right? So it's all connected. I don't know. That's something. I don't know if that makes you feel good or bad. That makes you feel confused or empowered. But basically, we'll want to find out what your body's telling you, right? Because if we, like, pain isn't just there to be there. Pain is trying to tell you something. It's your body saying something's wrong. We need to address it. So I actually try to see pain as a good thing because it's trying to prevent further damage. And sometimes you get in a cycle where the pain is no longer really telling you anything. It's kind of a misshapen signal. But in general, pain is there for a reason. It might be trying to tell you there's inflammation, a fracture, infection, some sort of growth, a neoplasm. It could be referred pain from an organ. And oftentimes we store our stress, our emotions, that can be stored in our connective tissue, in our muscles, in our back as well. So a lot of these things are not really things that we can work on as far as like corrective exercise or physical therapy is concerned, right? A lot of these are medical issues, possibly, psychological. And when I say psychological, I don't mean like it's all in your head. The pain is still real and the problem is still real, but there might be a psychological component to help kind of release and get rid of that pain. From a more physical standpoint, we often have instability. And so the pain might be telling you like there's something moving here that shouldn't, and it's trying to protect you from whatever that is, right? Protecting you from further damage, from, cutting off conduction to that nerve. And as a result, you're going to move differently because your body doesn't want to go into that range of motion. You're going to compensate, and then you might have kind of these secondary things going on in your body. Chronic stress, often due to poor posture, or things that you have to do for your work. Sitting obviously is one of them. We're always in this one position, and then that can cause things to kind of lock down if you're not moving. That's that hypomobility, under movement. And if you think you're in this hunched over thing, some muscles and tissues and structures are constantly going to be under extreme tension, and some are going to be shortened, right? And then they're just going to adapt to that. Your body adapts to what's the stresses that are placed upon it. And things that are structural, we have those discs protruding that we talked about, narrowing of the canals where the nerves come out. We can have degenerative changes. And again, hypomobility comes into that into play there as well. Something that I often hear is, do I need an X-ray or an MRI? Patients are always wondering, like what results they should be, or what images they should get. And the short answer is probably not. Obviously, there's certain red flags that would cause you to want to get an MRI, but there are different countries, different kind of groups of doctors. They're all saying, in the absence of any of these red flags, you don't need the MRI, right? It's not going to tell you anything that is going to inform your treatment, right? If we look at this red flag thing, we're looking for signs that it might be a tumor or an infection. A caudate quant is when the kind of after the spinal cord ends, there's all these nerves. If that's impinged, that's a really dangerous thing. So changes in bowel and bladder, I often like to say, if you can change your pain by the position you're in or by the movement that you do, it's likely musculoskeletal. It's not something that is you need to go to the emergency room right now, right? Unexplained weight loss, fever, chills, all those things, signs of systemic problems, right? That would be more infection. And so that's a good short list of the red flags that might tell you you should get some more information. But let me show you why you don't need the imaging. I think if anything, imaging can, I don't know if I put this in here, but there's been studies that show that imaging can actually decrease the effectiveness of conservative therapy. So that's non-surgical treatment. Because when you see something and you see what you believe is a problem and what the doctor is telling you is abnormal, you get that in your head, and then there's less, your locus of control is more external than internal. You're thinking all this stuff is happening to me versus I have control over it. So if you look at these numbers, these are numbers for a population that has no low back pain. So if we're looking in, say, the 50 to 59 range, 80% of people with no low back pain, never had low back pain or never, gone to the doctor for it or whatever, have disc degeneration. 60% are going to have a disc bulge. 36% are going to have a disc protrusion, right? So someone does an MRI and they're like, oh, you have, arthritis in your spine. All these, it's degenerating. You have a bulge, whatever. That's the cause of your low back pain. Well, in 80% of people with, no low back pain, they might have the same thing. So the correlation between what you find on an MRI and what you're experiencing in terms of pain is very, very low and very non-informative. So, I would say in general, you don't need it unless you just want to see it. So that to me is encouraging, but I guess, let's see. Yeah, so if you've already had one and you've seen that, don't worry about it. You can have that stuff going on, and doesn't mean you need to have pain, right? You don't have to be in pain even if you have those things on your imaging. So obviously there's a lot of information. There could be a ton of ways to break this down. What I'm going to do is try to just simplify it. And this is not going to encompass every situation, but in general, I thought a lot about this. And I think your back pain can be explained in basically three ways. Either you have too much movement, and your body's trying to protect you from that. You have not enough movement, and your body's trying to compensate for that. Or there's not enough space somewhere. So either that's something pressing on the nerves or whatnot. And then on top of that, you have two different stages. You have your acute stage where it's just happening, it's new, usually from some sort of traumatic incident. Maybe you lifted something too heavy, maybe you were in a car accident. And then there's chronic, right? All the changes have happened, and now we have other things that we're dealing with, right? So that brings us to what can you do? First, we got to address the problem. So we need to find out what the problem is, right? If it's a hypomobility, we want to fix that so you can move better. So this is very simple again, right? If there's too much movement, right? We want to train stability. We want to find ways to use the proper muscles, to use everything in that area to stabilize so that it's not moving too much. If it's not moving too much, the body doesn't interpret it as dangerous. And if it's not dangerous, there's probably no pain signal, right? So training stability. And that's not as simple as saying like, I need to do more crunches or I need to work my abs more. And even when we say like train the core, it's very non-specific. Everyone's going to have a different definition. So what does that really look like? Well, it's looking at like activating the right muscles. So if you don't know how to do that already, it's having someone look at you, and it might need to be hands-on. If you've tried these things before, sometimes, you're just going to start the exercise program and it's going to work. For a lot of people that does work. If that's not working for you, it might mean you need some sort of hands-on treatment to help you activate the certain muscles, because it might involve some sort of relationship between something else in your body. But that's the basic thing. If there's too little movement, we need to increase that mobility. Very simple, right? If it's not moving, we need to move it. Again, if flexibility, mobility training on your own is not working, sometimes you need that hands-on. Sometimes you need to get into that massage or get into that manual therapy with your PT or whoever it is, right? Sometimes we need to be more specific. And that can involve chiropractic care as well, right? Sometimes they're very highly trained in moving those segments, and that can be really effective. There's certain clinical prediction rules, which we won't go into, where if you meet these certain criteria, you have a high likelihood of that benefiting you, like a chiropractic adjustment. But also PTs can do that stuff too. So it doesn't always have to be a chiropractor. And then if there's too little space, we need to increase that space. That's things like manual or mechanical traction, pulling sort of the different vertebral bodies apart, right? Opening up the space. And we can do that either by pulling manually with our hands, or you can be hooked up to a machine to do it, and it kind of can change the settings on there. There's also exercises you can do that kind of encourage that as well. So super simple, right? We got to find the problem and address it. All right. That's basically all I had. Obviously, it's general, but I hope that was a good overview to start. And I wanted to make sure we had time for questions. We still have a good 20 minutes before Zoom cuts us off. So, but before we go into like your questions, you can always email me. I'm actually, during this time, like I mentioned, I have a little bit of extra free time doing free consults, 15, 20 minutes. Video chat, I think, is best because I want to like see what you're doing, see how you're moving, and then, maybe give you a couple things that you can do. If it's not enough time, I'm open to schedule virtual or in-person appointments as well. So let's see what we got for questions. I'm going to pull up the chat and see if I got anything there. Okay. Cool. All right. You can unmute yourself if you have a question, or you can type it into the chat box.
I don't have a question. I just want to say thanks for doing this.
Yeah, absolutely. I hope it was informational.
Let me think if I have a question.
Okay.
I get hit up a lot, Greg, just, when people throw their back out, what should I do? What should I do? And my answer is always knees to chest, or supine twists, or that kind of thing. Yeah.
So it depends on what it is, right? So if we look at the spine, let me go back. So knees to chest, if you're thinking about the spine, right? That's going to be kind of, let's see, if the screen is the front of your spine and this is it, knees to chest is going to flex the spine, right? So in the front of the disc, you're decreasing the space, and in the back of the disc, you are increasing the space. What that's doing is it's creating negative pressure, positive pressure on the front side. And so if you have a bulging disc, that will likely feel worse, right? I'd say for a lot of people who have more of that facet dysfunction, the posterior or backside of the spine, where the bones are kind of too close to each other, what that's going to do is it's going to open up those bones, and that's going to relieve the pain. If we have a bulging disc, there's something called the Mackenzie protocol. Basically, it is just repeated back extensions, like being on your stomach and getting onto your elbows over and over again. That's going to create a vacuum effect and actually try to pull the disc back in. But I hope that's helpful. But yeah, I mean, generally moving is good, right? So going into that flexion repeatedly is helpful. Rotating, trying to almost like calm the tissues down can be really helpful. I should point out one other thing. If they are having the radiating pain, the first thing we try to do is what's called centralizing the pain. So it actually might involve increasing the pain in the back itself, but the goal is to get it out of the legs, right? That's the first goal, is get it out of the legs, out of the thighs, out of the butt, into the back, kind of consolidate it all, and then you can work on getting rid of the pain. But the first step is trying to centralize it.
Greg, can you repeat that, what you said that exercise was? You cut out a little bit and I wanted to hear that.
Yeah, sure. So it's called the Mackenzie protocol, and it's repeated extensions. So that would be like being on your stomach and raising up onto your elbows, kind of like the Sphinx pose, right?
Okay.
And if it's really bad, you're barely going to be able to even lie on your stomach, right? So just lying on your stomach is a good start. And then you're trying to progressively get a little bit higher. Oh, sorry. And then you're progressively trying to get a little bit more range of motion.
Thank you.
Yeah, of course. I had a question from Bill Hagar before the class, because he knew he couldn't make it, and it was talking about deadlifts. What he's talking about is sort of that straight leg lift, where we're bringing the weights down the front of our shins and then bringing them back, and the back stays flat the whole time. He mentioned getting a little bit of pain with that. I didn't have a whole lot of I didn't get a lot more information. I don't know if the pain is shooting down or what's happening, or if it's just a muscular thing. But what I would say with that is, more than likely it is a technique thing. And when I say that, I don't mean like if you looked at yourself doing the exercise, it's going to look wrong. I think we learned this in class over the weekend, is you can look good doing the exercise, but there might be little things like where your weight is in your feet, or, just the amount of hinge, or the amount of, lordosis or arch in your back, that can make a big difference in what we feel, and what muscles are active and how we perform the exercise.
Hey, Greg.
Hi.
Hi. Can you kind of describe what good posture is?
Yeah, I can try. So I'd say in general, optimal posture is described as, in terms of the spine, let's start there in the center. If you look at the cervical spine, there's going to be a little bit of lordosis, meaning it should curve like this, like your low back. It should curve, I'll try to do it without you seeing me, but up and back, right? That should be what's happening in the cervical spine. The thoracic spine is bent the other way, which is called kyphosis. And then the lumbar spine has that lordosis again. Those curves are important for being your shock absorber, right? If everything was perfectly straight, it's going to be very rigid, and the only thing that would absorb the shock is the discs, right? And they can only tolerate so much compression before they just give up. So that curvature is really, really important. What that results in is generally it's like your ears are over your shoulders or over your hips or over your knees or over, over your feet. So oftentimes we'll see that forward head posture. And what that is the cervical spine is bending forward. But in order to keep your eyes level, which is the ultimate goal of the body, right? Your posture and your brain is always telling you to keep your eyes level. So if your head is forward, then that last bit where this is your skull and this is the first vertebrae, right? It's sitting in here rocking back and forth. So if everything else is forward, it's going to force that to turn back, right? So that's when these muscles right up in here get really, really tight because you're forward, but you're back at that suboccipital level, right? And then when the shoulders get rounded, that thoracic spine goes into excessive kyphosis, which then the cervical spine needs to make up for, right? So maybe that's going to go into excessive lordosis. So it's all a give and take. And achieving that posture may not be possible right at the start, right? You're working towards it. But in general, ears over shoulders, over hips, over knees, over feet is the general thing. As far as cracking your back, Nina writes, I would say it depends. It's neither necessarily good or bad. All the cracking sound is a very quick expansion of the space of the joint capsule. So the joint capsule normally has a synovial fluid in there in a liquid state. If you quickly expand that, if you remember your science, the change in pressure changes the liquid to a gaseous state. That change in state is what produces the sound. So inherently, that is not necessarily bad. If it's kind of performed in a very aggressive way, you can imagine opening up that synovial space. It can create pressure on kind of the lining of the joint. But in general, I think it's not necessarily bad. What it does do, what it's good for, is temporary relief. It creates a kind of a chemical physiological signal to the brain through the nervous system that gives you some relaxation, and it gives you some pain relief as well. And so it can be useful for that. One thing it can do is create those hypermobilities, so too much movement at a particular segment. A lot of times, if we're not specific with it, we have one segment, like I mentioned, is trying to perform a lot of the movement since others are locked down. And usually we have a hard time cracking the segments that are super locked down. So what might be happening is that the segment that's already overly flexible, overly mobile, is the one that's getting cracked over and over again. And so, I don't know. That's not really a yes or no answer to your question, but that's why you feel better. And hopefully that is helpful. Let's see. Matt asks tips and tricks for a desk all day. So I'd say the biggest thing is just moving. So I'm a fidgeter, and I think that's a good thing when it comes to sitting all day. Like I'm shifting my weight to my right. I'm shifting my weight to the left. I'm pushing up on my arms to lift my butt off the chair. I'll kind of go into a rounded posture, and then I'll go into overly straight posture. Like I can't help it. It can be annoying if someone's sitting next to you, as Bree would attest to, but I think it's good for me, and I can't help it. So I would say just moving. So if you're not naturally a fidgeter, that might involve setting a timer for, say, 20, 30 minutes. And it doesn't mean you have to get away from your desk. It just might be like twisting side to side, reaching down, touching your toes, coming back up, going through the ranges of motion. I think lifting some of the pressure off of your butt is a good thing too. And just neck range of motion, shoulder rolls, right? I don't think you have to be super specific with what you're doing. It's just doing something regularly. So you're not just sitting in the same position. The times that I do get pain in the neck, low back, whatever, it's when I'm so focused on something that I've literally just been sitting there without moving, right? And so if you need a reminder, I would set that alarm and do that. But really, motion is lotion, as they say, and that'll help keep you moving. Let's see. Hopefully that was helpful. And then, let's see, back cracking. As far as doing it, back cracking with plank and push-ups, I would say that's a sign that you're getting maybe too much movement when you're doing those things. So that might be dialing in those core stabilizer muscles, right? The fact that you can do it is good, but maybe some of the movement muscles are taking over and trying to do the work of the stabilizers. They like to do that. It's very, very common. And if that's happening, it's just not going to be locked in the same way it would be if those like small muscles close to the spine are doing that job, right? If you imagine a suspension bridge, right, and you have all these little pieces going across, and you have one cable running the length of it, that would be like one of your movement muscles. If you contract that cable, the bridge is going to be flat, but there's still going to be lots of movement between the segments, right? It's very non-specific in terms of its ability to stabilize. But if you think of all the little ropes or whatever that are connecting each and every plank of the bridge, if you tighten those down, how much more stable will each segment be, right? So that's what I'm thinking is happening, but I'd have to do an assessment to really see what's going on there. As far as a well-rounded physical activity that is best for dealing with back pain, it really does depend on what you're able to do, right? If you're currently in a situation where your back is hurting, you're going to be a little bit limited. I think walking is one of the best things we can do. It's a natural motion. We're in upright posture. Our hips are going through flexion and extension, right? We didn't really talk about it, but we talked a little bit about those lines through the body, right? And so a lot of things in the hips and legs can affect the low back. And, so I like walking because it's creating rotation. It's keeping you in like a position that in general is not super taxing on the back. And it's kind of allowing for that gentle motion. I would say as far as a single activity, that's probably what it is. It's probably walking. But then, as far as strengthening and improving the situation of pain, I think it's important and necessary to do the proper, strength training, mobility training, and things like that. Learning to control. So walking is good because it is light movement within a very limited range of motion for your back, right? But that's not life. That's not all of life. We're twisting, we're reaching up, we're bending down. And so doing the exercise to train your body slowly to be able to control new ranges of motion, right? If you've ever thrown out your back, you know that it's very stiff for a while, right? Like even if you can move, your brain, your whole body's telling you don't rotate, right? Like that's your body telling you the sign, like there's something that's gonna happen if you rotate. And you need to be able to send the signal to your body, like when I rotate 1 degree, it recognizes that stability, then progressing to 2 degrees, 3, 4, 5, up until, kind of your full range of motion. But it's a progressive process. And like all the other exercises, they have to be done, especially if you've tried them and they haven't worked, they have to be done with supervision, right? Because you can do the motion and not use the right muscles. You can do the motion and not have the motion in the right spot, even though it looks right from 6 feet away, 10 feet away, or whatever. So it's that hands-on, being able to feel what part is moving, what's giving you that motion, right? I can turn my neck to the side. I'm doing that because you can see my head. And hopefully I'm getting a certain percentage from every single vertebra on my spine, right? But if I'm super locked up at the bottom, it'll probably look the same, but I'm getting it from just 3 of them. That's going to cause a lot of problems, right? So hopefully that was helpful, Chris. I know. Yeah. Well, welcome, Jody. I'm glad. Any other questions? Looks like we got 2 minutes. 2 minutes remaining before it's going to cut me off. So we're doing good on time. We're going to make it under our 40-minute thing. If there's no question, I can revisit kind of those fascial lines kind of that I was talking about, right? If we look at this lumbar curve and those vertebral processes and things like that in that region, we got to also think about what muscles attached there, right? So we have the psoas, which is a hip flexor muscle, right? That's what we always talk about when we stretch our hip flexors. That's one of the muscles we're stretching. Think about if that's really tight and that's pulling, if the back is bent like this and it's on this front side here and it's pulling down, what is that going to create? That's going to create increase in that bend, right? An increase in that lumbar lordosis. And if you've been there a long time, that's just going to create more stress, right, to that spine. And so that's just one example of how something outside of the back can affect your low back. But we have less than a minute, so I hope I got to all your questions. If not, send me an email, schedule with me. I'm happy to talk to you over video chat for that 15 to 20-minute consult, see if we can figure out something more specific. But it's great to see you. Thanks so much for coming, and I hope it was helpful. If there's any other topic you want to hear about, let me know. I'm willing to do more. Doesn't always have to be about the back, but that's 101, and if we want a 201 course, we can do that as well. So have a wonderful night, and I will see you all soon. Thank you so much.